Thank you everybody for joining us this evening. My name is Sharon Koshin and I am the Self-Directed Support Program Manager here at Ripon. Tonight's presentation is Work Pays, Work Incentives for Youth, presented by benefit counselors from the Paul V. Sherlock Center on Disabilities. I'm going to hand the program over to Laura, who's going to just give you a few information slides, and then we'll turn it over to our presenters. Laura?
Hi, I'm Laura McGreevy, and I'm the support navigator in the Self-Directed Support Program at Ripon. A little bit about Ripon. We are an independent 501c3 nonprofit organization where most of our employees are peer professionals, which means that we've experienced something like what you are also dealing with. So we help Rhode Islanders of all ages, abilities, and across the lifespan, and we help them to navigate healthcare, education, healthy aging, and other complex services and systems. What is self-direction? Self-direction is a model for service for adults with intellectual and developmental disabilities. You need to have been found eligible for funding through the Behavioral Healthcare Developmental Disabilities in Hospitals, known as BHDDH. And self-direction allows you to have more control over your own budgets, hire your staff, and set the way you want to live your life that's unique to you and your goals. And Ripon's Self-Directed Support Program is here to help you do that and and provide information and education and training around these the building the capacity for you to do self-direction. We share resources. We work with organizations such as Sherlock as our partners, and we refer people to other people and organizations that can help you make the best of your self-direction. And so I'm going to introduce Josh Hughes and Ian Armistead from the Paul V. Sherlock Center on Disabilities. They are both work incentives and benefits counselors there.
So my name is Josh Hughes. I'm a work incentive benefits counselor with the Paul V. Sherlock Center on Disabilities at Rhode Island College. And I'm really happy to be joining you all today. And I want to, really thank you for taking your time on this Tuesday and going over this material with us because we think it's important. So today our focus is to go over some specific work incentives that are for youth. So we're going to go over some different work incentives that youth can take advantage of. So I'm just going to read a quick disclaimer. This presentation is for information purposes only. Social Security regulations and other information may change, so always check with the original source for the most up-to-date information. Okay, so our agenda for today, we just did our welcome and overview. So step one done. And then next we're going to move on to the benefits of employment. We're going to talk about accessing work incentives and benefits counseling. We're going to review the differences between the SSI program and the SSDI program. We're going to go over more in depth the SSI work incentives because most youth are going to be receiving SSI. We're going to go over how to report earnings and avoid overpayments. And then we're going to touch on the ABLE account and a whole host of resources that could be beneficial to you. Okay, so what are some benefits of employment? So work is an expected adult role, and there's obviously that financial benefit of employment, but there's also many other benefits from seeking employment and entering the workforce. So work helps us use skills that we already have and also develop new skills and goals. It affords us new opportunities for friendship and social activities. It makes life more balanced, satisfied, and meaningful. And it's also proven that it improves health outcomes and overall health and well-being. And specifically for youth, individuals who are working are paying into Social Security taxes, which can result in eligibility for SSDI by building up those work credits, and then also in turn make you eligible for Social Security retirement benefits further on down the line. So a lot of benefits to employment aside from the paycheck. The paycheck's very nice, obviously, but when we work with people, we often hear that there's a lot of other positives to working. Okay, so I'm just going to play a quick video that goes over some tips to manage your benefits and avoid some of those overpayments and things like that I've talked about. So the Sherlock Center has recently added some new videos to our arsenal of information. So these videos will be on our website probably likely by the end of the week. So anyone watching will have access to these videos going forward. So let's kick it off and start with the first video here.
Tips for managing your benefits when you work. A Griffin Hammis production tailored for Rhode Island and Connecticut.
Hey, I just got a new job.
Excellent.
Yeah, but I'm not sure what to do about my government benefits now that I'm working.
Okay. Well, here are 6 tips for you. The first tip is look at the whole picture to see if you come out financially ahead.
Look at the whole picture? What do you mean?
Take a look at this picture. What do you see?
I see an angry animal face.
Right. Let's look at the whole picture. Now, what do you see?
Now I get it. The whole picture shows a butterfly. The angry face was just part of the design on its wing.
You got it. Now let's take another example. Your government benefits and your wages. Let's look at the total cash benefits you get now. So here's what will happen to your benefits with this job. Your cash benefits will go down. How do you feel about this?
That makes me worried. Those benefits are my safety net. I can't afford to lose so much income.
That makes sense. But let's look now at the whole picture. Your cash benefits will go down, but your total income will go up. Look how much more money you have from work, even after taxes. So now, how do you feel about the job?
I feel a lot better. I can see I'll get ahead.
Yeah, you're usually much better off working, even if your benefits get reduced. You can learn how to see the whole picture with your new job by speaking with a work incentives benefits planner. To learn more about working with benefits, contact the Ticket to Work helpline at 866-968-7842 or visit sherlockcenter.org. Click on Services and Projects, and then click on Work Incentives Benefits Counseling. Here's the second tip. Report your wages.
Who do I need to report my wages to?
You should report your wages to every agency that gives you benefits, such as Social Security, Rhode Island's Department of Human Services, or Connecticut's Department of Social Services and Housing Authority.
Why do I need to report my wages anyway?
To make sure you get the right amount of benefit. If you don't report your wages, you might get higher benefits than you should, and you'll have to pay the extra benefits back. That's called an overpayment. If you don't report for a long time, you could end up owing a lot of money. And sometimes if you don't report, you could have the opposite problem. Your benefits could be reduced too much, and you wouldn't get enough.
That would stink. I'll be sure to report my wages.
Okay, the third tip is learn about work incentives.
What are work incentives?
They're safety nets that help protect benefits and make sure you're better off working. Work incentives can help you pay for some work-related expenses, help you keep your cash benefits, or remain eligible for your health insurance, for example.
Wow, that sounds great. Can I use work incentives with my new job?
You probably can. You can learn about work incentives by attending one of the Sherlock Center's Work Incentives information webinars. If you live in Connecticut or Rhode Island, you can also speak with a certified work incentives benefits planner at the Sherlock Center to get help understanding which work incentives you could use. To learn more and register, visit sherlockcenter.org. The fourth tip is organize your benefits paperwork. You should save all your pay stubs, anything you send to benefit agencies, and any letters or forms they send you. You should also keep notes of all the meetings or phone calls you have with benefit agencies. You can save all your notes and documents in a paper folder, or you can scan all the paper and save it electronically. Okay, tip number 5, prepare for overpayment.
Whoa, wait a minute. I thought you said that if I report my wages, I won't have overpayment.
Reporting your wages will limit overpayment, but it won't always prevent them completely. The system often takes longer than it should to adjust your benefits, even if you report your wages. But you can make sure that if you do get overpaid, you'll know it's happening. You can set aside the extra benefits you get so you can repay the overpayment. A work incentives benefits planner at the Sherlock Center can help you make a plan.
That sounds good.
Okay, here's tip number 6. Set aside some money for your future. When you have a job, it helps to save some money for emergencies, things you want to buy, and maybe retirement. Learn more about how some people with disabilities can save through an ABLE account.
Great. I'm feeling a lot better about my job now.
Good. And you know, you can learn even more about managing your benefit at sherlockcenter.org. And if you'd like to talk to a certified work incentives benefits planner about how to manage your benefits when you work, call the Ticket to Work helpline at 1-866-968-7842. If you are considering work, you can also contact the Sherlock Center on Disabilities at 401-456-8072. Knowledge is power. Take time to learn more about managing your benefits when you work. This video was created and shared at U.S. taxpayer expense through a Social Security Administration grant. It is not an official Social Security communication. This presentation is for information purposes only. Social Security Administration regulations and other information may change. Always check with the original source for the most up-to-date information.
Okay, so, we often hear from beneficiaries that come to us, they've quit their job or they're thinking about quitting their job because they get an unexpected overpayment or they have some issue with their benefits that could have been avoided. So if you follow some of those tips in that video, it's really gonna lessen the chance that you get any sort of overpayment or have any really unexpected issues happen with your benefits. Okay, so let's talk a little bit about work incentive information and benefits counseling. So some answers. So benefits counseling allows you to kind of answer some questions that you might have. So a lot of people we hear that come to us are fearful that they're going to lose their SSI or SSDI check. They have questions about, are they able to keep their Medicaid or Medicare? If I do lose my check, is it easy to get back? Will Social Security determine I'm not disabled anymore because I'm trying to go back to work? And can I save money and still be eligible for benefits? So we hear these questions very often, and luckily there's a lot of work incentives and safety nets in place for medical insurance or to have your cash payments restarted if you do work and your benefits go away. So we'll kind of go over what some of those work incentives are a little bit later. But benefits counseling also can provide you with answers to these questions. And working with a benefits counselor, they're going to go over the impact of earnings on SSI and SSDI, as well as your Medicare. So you have a full picture of how this job is going to impact your benefits, if at all. They're also going to review work incentives that are offered by Social Security, and if those work incentives are relevant to your situation and you're able to take advantage of them. We're also going to focus a lot on wage reporting and how to avoid those overpayments, steps you can take to make sure that those overpayments or lessen the chance of those overpayments happening to you. And then another piece of this, especially when we're talking about youth, is transition planning. So using fact-based decision making in planning transitioning from school services to adult services, and how adult benefits differ from benefits you might get as somebody under 18. Okay, so in Rhode Island, there's a few different ways to access benefits counseling. One way is through the Work Incentive Planning and Assistance Program, which is housed at the Sherlock Center on Disabilities. And you can contact the Ticket to Work helpline, and the number is 1-866-968-7842. If you contact that number and you have questions about work impacting your benefits, they're going to refer you to the WIPA project, which is housed at the Sherlock Center. To be eligible, you have to be 14 years of age or older, and you have to be receiving some form of Social Security disability benefits. The other two ways to access benefits counseling are through the Office of Rehabilitation Services. If you're a client of ORS, you can discuss benefits counseling with your VR counselor, and they can refer you to benefits counseling through their own vendors. If you are a consumer of BHDDH services through the Department of Developmental Disabilities, you could submit an EERF form and request benefits counseling, and those referrals also come through to the Sherlock Center. So two of the three ways in Rhode Island are serviced through the Sherlock Center. Okay, so Social Security disability benefits. So there's really two main programs, and there's big differences between the two. So first, we're going to talk about the Supplemental Security Income, which is SSI. And most youth that we see are going to be receiving SSI unless they have a parent who's retired, deceased, or disabled. So SSI is typically for individuals with little or no income or savings. The federal maximum payment for 2025 is $967 a month. In some instances, you may receive less if you live with family. Individuals on SSI are eligible for Medicaid upon eligibility for SSI. And typically, someone on SSI is going to get paid on the first of the month and also receive a small supplementary payment from the state of Rhode Island. SSDI is Social Security Disability Insurance, and so you must have a work history or be a disabled child or spouse of a qualified worker who is disabled, deceased, or retired. So some instances you're going to receive SSDI based on your own work record, or you could receive SSDI based on a work record of a parent or a spouse. In the SSDI program, the payment amounts are going to vary depending on how much you've paid into Social Security taxes. You're also going to receive Medicare, which is federal insurance, after 24 months of entitlement to the SSDI program. You're going to receive your SSDI payment on the 3rd of the month or on a recurring Wednesday of the month. And in some instances, if your SSDI payment is low, you may receive a supplemental SSI payment as well. So it is possible to receive both SSI and SSDI. Okay, so if you're not sure what type of Social Security benefit you're receiving, we often hear people come to us and say, I'm on Social Security, I'm not sure what benefit I'm on. There's a few different ways you can confirm. One way is if you have a My Social Security account online, or if you don't have one, you can create one. And once you have access to that account, you can log in and it'll give you information about what type of benefit you're receiving. Another way is if you have a copy of your award letter from Social Security, that's going to say right on that award letter, supplemental security income or Social Security disability insurance. So you'll be able to confirm that through the award letter. And the third way would be to contact the Ticket to Work helpline, and they can also confirm your benefits through the helpline staff that answer the calls there. So it's really important if you're receiving Social Security benefits and you're not sure what type of benefit you're getting, try to confirm which type you're getting so you know what type of work incentives and which type of rules to apply to your specific situation, especially if you're thinking about employment. All right, so some important facts about SSI and SSDI. So like I mentioned, SSI and SSDI are two very different programs, and work is going to impact each program differently. So if you have SSI and you're talking to a friend who has SSDI, they may be telling you about how work impacts their situation, but that's going to be completely different to how work impacts your situation. It's important to know that both SSI and SSDI benefits include health insurance, and that the health insurance may continue even if your Social Security payments stop. So there's some work incentives associated with maintaining your medical coverage, even if your cash payments stop. SSI payments often are reduced when you're working. So, as you work, your SSI check goes down. SSDI payments are either paid in full or they stop completely. So I like to say SSDI is like an all or nothing program. SSI, you're going to have your payment reduced based on how much you're earning. And if your SSI or SSDI payment stops due to earnings, they can often be restarted easily. You can just, in most instances, contact Social Security and have your benefits restarted. Okay, so now we're going to dive a little bit more deeper into the SSI program. And I'm going to hand things over to my colleague and fellow benefits counselor, Ian Armistead, to dive into things a little bit deeper. Thanks, Ian.
Thank you. So as Josh said earlier, SSI, the Supplemental Security Income Program, is what's called a needs-based or a means-tested program. So this you may sometimes hear referred to as a federal welfare program. It just means that it's not based on your work record. So this is for someone who is either just starting out on work or hasn't had enough of those SSDI taxes paid in yet. In Rhode Island, SSI recipients are automatically eligible for Medicaid. That becomes part with your SSI. Before the age of 18, parental income is counted, and that can affect how much of the benefit you can receive, or it may even make you ineligible, even if a significant disability exists. At the age of 18, your parents' money no longer counts. So someone who was not eligible for SSI before 18 may then become eligible upon turning 18. But then there's the opposite that could happen. Some people who were receiving SSI, at the time you turn 18, you have what's called the age 18 redetermination process, because the rules for eligibility when you are under 18 are different for SSI than when you are over 18. Thank you, Josh. So the part of the definition, once you have reached age 18, is your ability to work. And that is not included in the under age 18 definition of disability. So all of these decisions can be appealed if you decide that, hey, that's not quite right. But it's important for us to point out that there is a work incentive, it's referred to as Section 301, that can allow someone who was receiving SSI under age 18 to continue to receive that while they are in what's referred to as a vocational plan. So that would be if you're still in school and you're going through the Transitional Academy, or if you're currently working with Office of Rehabilitation Services, that can continue those SSI benefits. Section 301 is very complicated. So if this does become important to you, we would very much recommend reaching out to a benefits counselor so they can go more in depth with you. So SSI, that is also referred to as Title 16 sometimes. There's also Title II benefits. Those are the SSDI. So children's benefits. This is paid to a child when the parent is disabled, deceased, or retired, even if that child is not disabled. But those Title II children's benefits would end when that person turns 18 because they are now an adult and are no longer considered a dependent of that disabled, deceased, or retired parent. If that child is disabled, instead that parent can apply for the childhood disability benefit, so CDB. That is a form of SSDI for the child based on that parent's work history. So when someone is working, there are a number of rules. We refer to them as work incentives because they can help you to work and make more money while still receiving the benefits you need. And they are different for SSI and SSDI, as you may have noticed the trend. For SSI, because that one, your check is reduced by how much money you earn, there are those income exclusions. And we'll give you an example of some of those later on. An important one to point out for the youth, though, is there's one referred to as the student earned income exclusion. This is a work incentive that is only available for students under the age of 22, and it can help you make a lot more money before there is any impact to your SSI cash benefit. And we did just talk briefly about Section 301. And we had mentioned earlier that there are incentives to help protect your health insurance. So for Medicaid, even if your SSI check is reduced to zero because of how much money you're making, there is the Medicaid 1619B protection, which means that even if your SSI stops, your health insurance will continue. We haven't gotten the figure for 2025 yet, but for last year, your Medicaid would continue until you were making at least $41,109 for that year. For SSDI, the incentives are a little different. So that first one there, the IRWE, is the impairment-related work expenses. This allows you to deduct certain things that you pay for out of pocket from that monthly earning amount. There are subsidies and special conditions. This would be something like a job coach, or if the worker has different responsibilities than their coworkers. There's income averaging. So if you're earning slightly above what's known as that substantial gainful activity amount, that's the important number for SSDI. If you earn slightly above that for 1 month, but then below that for the next month, Social Security can sort of average those together to see if you're actually below the amount. The plan for achieving self-support is one that's actually for both SSI and SSDI, which can help you save money so that it doesn't impact your benefits while you're achieving a work goal. And SSDI also has 3 phases that you go through. So this is another work incentive of a sort. Initially, you're in your trial work period where you can make as much money as you want per month. It doesn't matter, it doesn't affect your benefits. Then you move into your extended period of eligibility, and that's where that substantial gainful activity amount becomes important. That's where Social Security really takes a look at how much money you're earning per month and where those work incentives become very important. So after your trial work period, so that extended period of eligibility and that post-extended period of eligibility is where that substantial gainful activity amount, SGA, becomes important. And then for Medicare, there's a work incentive that protects that, which will protect that for at least 7 years and 8 months, if I do the math correct, after the end of your trial work period. But there's a lot more math that goes into that. But it's safe to say that for at least 7 years after the end of your trial work period, you can maintain Medicare even if your SSDI stops. So that student earned income exclusion, this is the big one. So the first $2,350 per month for this year 2025 is excluded from that earned income up to a total amount of $9,460. And this is for a calendar year. So from January to December, not the school year. So that's one thing to keep in mind. But what this means is before anything else, Social Security is going to ignore the first $2,350 a month for any student under 22, but you do have to request this work incentive. So your school can help you assist with in requesting that ahead of time, or a benefits counselor can. But you have to make sure that you request that before you start working, because they won't be able to apply that to past months. But that one is a very big work incentive for youth. It can help them save, well, to help them earn a lot more while maintaining their benefits. So an example of that, if the individual has the SSI of $967, that $39.92 is the supplemental payment from the state of Rhode Island. They have the part-time job earning of $700 gross. They will have that full amount of their $700 because it's less than the annual amount of, I'm sorry, less than the monthly amount of that SEIE. And then their SSI and their monthly gross from the work, $1,706.92. So he would keep all of his SSI and that supplemental payment while earning $700. So that was a big increase to his monthly earning. So those impairment-related work expenses, these are for both SSI and SSDI. I apologize. Oh, Josh, we talk about blind work expenses later yet?
Not in this session, no.
Okay, we're going to keep it simple, right? So the impairment-related work expenses, these are things that you pay for out of pocket that are not reimbursed by insurance or any other program, but are things you need in order to work. There is no list that says these things count and these things do not count, but some examples of those are co-payments for medical service, medications, medical supplies or equipment, special transportation to or from work, and many, many other things. These impairment-related work expenses must be reported to and approved by Social Security, and you would need to keep those receipts to send in to claim those expenses, and they would be accounted at 50 cents on the dollar, so 1/2 of that total amount would be excluded from your earnings for the purpose of reducing your SSI, which means that if you have $100 of impairment-related work expenses, you get to keep $50 more in your SSI check. So that Medicaid protection, that's a really big one. We were talking about if your SSI is reduced to 0, that's that break-even point, they call that. So if as your earnings go up, your SSI tends to go down. If it eventually is brought down to $0 because you're making more than twice the SSI amount, that 1619B will come into play. You need to have been receiving SSI for at least 1 month prior to having that break-even point. Your SSI must be stopped only due to earnings and not because of any other eligibility reasons. And you have to have, so that's, it says on there, the resource limits. And that $41,109 was the threshold limit for last year. We're still waiting on the new numbers for this year, but it means if I had Medicaid last month, but I worked more this month and my check goes down to 0, I will still have my Medicaid because of 1619B. If it so happens that you are earning more than that amount, first, congratulations. But what that means for your Medicaid is you may want to look into Medicaid for working people with disabilities. Sometimes this is referred to, well, was referred to as the Sherlock plan. That still exists, but that's now for people over the age of 65. The state created a new plan last June, but the requirement for both is that you have to be a person who is working. So it can be for SSDI or SSI if you're earning above that 1619B. And it's also referred to as a buy-in program because there is a premium you may have to pay. It's a sliding scale based on income. The thing we want to point out with this one is this new Medicaid buy-in program referred to in the state as Ticket to Work Medicaid buy-in for people with the working people with disabilities. There is no income or asset limit. So with SSI-based Medicaid, you have to maintain less than $2,000 in assets, which are savings, stocks, stuff like that. With this new program, that asset limit goes away. For those folks who are above the age of 65, that Sherlock plan remains the way it was. So it's 250% of the federal poverty limit and that asset limit of $10,000. But it's great news for the youth working nowadays. They don't have to worry about losing their Medicaid because of assets or income. So reporting your SSI wages, you want either the individual themselves or the representative payee wants to report when the person starts working. So contact your local Social Security office, ask how your local office prefers that you report. Some of the offices have different ways they prefer you report. If you're already aware of some of those potential work incentives, you're going to want to discuss that with the office at that time, especially for things like the impairment-related work expense or that student earned income exclusion, because they need to be approved by Social Security ahead of time. And then once you've started working and you've made that initial report, you can use the Social Security wage reporting line or their smartphone app. You cannot use that option if you have those impairment-related work expenses because you need to send those receipts in every month. But once the SEIE is in place, that will work automatically, or you have that My Social Security account, or you still have the option of writing or faxing or visiting your local Social Security office. Make sure to bring your pay stubs and those impairment-related work expense receipts. And now Josh is going to have us a little video about ABLE accounts, another big important things for how to get ahead while working.
Yeah, so I'm going to play another new video that we have on ABLE accounts. So essentially, an ABLE account is something that allows someone on SSI or Medicaid to save above the resource limits. Ian talked about some of the resource limits that individuals on SSI have to stay below $2,000 in total resources. An ABLE account is a great way to be able to save above those resource limits. So I'm just going to play that now.
ABLE accounts, how to save money and keep your benefits. A Griffin Hammes production tailored for Connecticut and Rhode Island. Hey,
I just got a job, and I'm ready to celebrate.
Congratulations. That's great news.
Yeah, I'm tired of having so little money. Now I'll be able to buy things I want. I'd really like to start saving some money too, but I can't
Why not?
because I get government benefit. They told me if I save too much, I'll lose my benefit.
Which government benefits do you get?
I get SSI, Medicaid, and SNAP.
Well, those benefits do have limits on savings, but there's a way you can save money and keep your benefits.
Really? Is it legal?
It's totally legal. It's called an ABLE account. It's an account that lets you save money without affecting the benefits.
I'm nervous about this. They told me I'd lose my benefits if I saved too much money.
I see why you're nervous, but luckily the government created ABLE accounts to help you save money and keep your benefits. The money in the account does not count against the savings limits for benefits you get.
Well, that makes sense. It didn't seem fair that I couldn't save money. Can anyone have an ABLE account?
Not everyone. You need to have a severe disability that started before you turned 26 years old.
My disability started when I was a kid, and it's severe enough for me to get SSI.
That means you should be eligible for an ABLE account.
Excellent. Can I open an ABLE account by myself?
You sure can. And if you need help opening your account or managing your money, another person could do it for you.
Got it. So how much can I save?
That's a good question. But first, let's talk about whose money can be saved. The money in your ABLE account belongs to you. You can save your own money in the account, and anyone else can contribute to your account too. Family, friends, agencies, employers, anyone.
Really? I heard that if other people gave me money, it could reduce or stop my benefit. But if they put money in my ABLE account, I can keep my benefit?
That's right. And quite a bit of money can be deposited into your account, at least $19,000 a year in 2025. If you're working for pay, you may also be able to deposit an additional $15,060 of money from your job. That's over $32,000 a year.
Wow.
Yeah, it's a great way to save. The SSI program doesn't count up to $100,000 in your ABLE account. So if you saved $101,000, only $1,000 would count against the $2,000 savings limit for SSI.
What about other benefits? How much do they let me save?
Other federally funded benefits will let you save the maximum amount allowed by the ABLE program you use. ABLE Connecticut lets you save up to $300,000, and Rhode Island's ABLE lets you save up to $395,000.
That's incredible. So once I've saved my money in my account, what can I spend it on?
You can spend the money on lots of things like food, clothing, housing, transportation, education, technology, personal support, job needs, health expenses, and money management. You can even spend it on funeral and burial costs.
Not bad. I think I'll call my bank and ask them about opening an ABLE account.
Well, you can't open an ABLE account through your local bank because they are managed by specific companies throughout the country, but it's easy to open one online. If you want to stay local and live in Connecticut, go to ct.savewithable.com. If you live in Rhode Island, go to ri.savewithable.com. Once you open the account, there are several ways to deposit and withdraw money electronically. For example, you can transfer money between your ABLE account and another bank account you have. People can also deposit money right into your ABLE account at ugiftable.com. You only need to deposit $25 to open an account.
I've heard there are different ways to invest your money to make more money. I'd like to have a choice about how my money gets invested.
That's good because an ABLE account gives you many choices to invest your money. Some are very safe, like a bank account. You have low risk of losing money, but you won't make a lot of money either. Other options are riskier, like stocks and bonds. You could lose money, but you could also earn a lot of money, especially in the long term. And the fees you pay for an ABLE account are reasonable.
Okay, I'm sold. Can you tell me one more time how I can open an ABLE account?
Like I said, there are ABLE accounts available nationally. However, if you want to stay local and live in Connecticut, go to ct.savewithable.com. If you live in Rhode Island, go to ri.savewithable.com.
It's good to know I can save money and keep the benefits I need.
You can learn even more about ABLE accounts at ablenrc.org. If you want to learn more about working with SSI and SSDI benefits, call the Ticket to Work helpline at 1-866-968-7842. Their TTY number is 1-866-833-2967. You can also visit the Sherlock Center on Disabilities website at www.sherlockcenter.org. The Sherlock Center provides work incentive planning and assistance services to beneficiaries who live in Connecticut and Rhode Island. Knowledge is power. Take time to learn more about ABLE accounts and working with benefits. This video was created and shared at U.S. taxpayer expense through a Social Security Administration grant. It is not an official Social Security communication. This presentation is for information purposes only. Social Security Administration regulations and other information may change. Always check with the original source for the most up-to-date information.
Okay, so just to kind of go over some of the highlights from that video. So in order to be eligible for an ABLE account, your disability has to have started before the age 26. That age will be going up to 46 starting in January of next year. So that's great news. That'll open up the ability for people to open up ABLE accounts for a whole range of other people that wouldn't have been eligible this year. So that's great news. Really, the big takeaways here is having an ABLE account is going to allow you to continue to access your SSI and Medicaid, and it's going to allow you to save. So if you're somebody who's working and you're having trouble staying below your resource limit, an ABLE account is a great way to save and allow you to maintain your benefits while putting aside some money for some things you might need. Okay, so we're just going to kind of go through a career path to self-sufficiency. So somebody who started out receiving benefits and how they work their way through, some of these work incentives that we talked about today, and eventually maybe even got off benefits. So we're going to start with somebody who got a part-time job while in high school. They're earning $500 a month, but they're able to use the student earned income exclusion, and they're able to keep all of their SSI check and their work wages. If you go over the next box here, they graduate. That student earned income exclusion ends because they're no longer a student. But now that they're not in school, they're able to work more hours, and they're able to take advantage of the general income exclusion and the earned income exclusion. And they have $100 in impairment-related work expenses a month. So this person's SSI check is going to be reduced, but their total monthly income is going to increase because of these work wages that they're adding on. So at this point, this individual's been working for a while. They've now paid enough into Social Security taxes to be eligible for SSDI. They've reached insured status, and they begin receiving $750 a month of SSDI. Now they're working, still working part-time, earning $1,000 per month, and they're able to keep all of their SSDI check while they're working. At this point, they've now developed a new job goal. They want to become a pet groomer. So they stop working to attend a training program. And they set up a past plan to help pay for the training program itself and the equipment that they're going to need in order to set up this business. So they set aside their SSI check into this past plan to help pay for these items and services. And this allows them to become eligible for SSI in the meantime to pay for living expenses. At this point, they've now finished the training program and they've become a full-time pet groomer, and they soon achieve self-sufficiency. They no longer receive cash payments, but they're able to keep their Medicaid through 1619B, and their Medicare is going to continue for several years through that extended period of Medicare coverage work incentive. And if they have that safety net in place, if the job doesn't work out, they can return to their SSDI benefit and continue to work part-time. So it's a kind of a good story of working through these different benefit programs, utilizing the work incentives that are available to you to, achieve your goals and ultimately help support yourself. All right, so we're at the Q&A portion of the session. I don't know if anyone has any questions about any of the material we talked about today or any of the specific work incentives that we've gone over.
Hi, Josh, this is Sharon. So there are a few questions in the chat. It looks like one of you have answered, but I'd just like to read them out loud for those that may not be able to access the chat.
Sure.
So the first question is, I'm interested in learning more about earned income exclusion. Would a benefits counselor be able to help me apply for this benefit? And
Yeah.
Ian replied, yes.
Yeah, absolutely. If any of these work incentives, if you have questions about them or really any questions about work impacting benefits in any way, and you think you might be eligible for a work incentive as well, you can definitely reach out to a benefits counselor and get more clarity on your questions.
Okay. The next question is, can work expenses, those ERWI work expenses, which is impairment related work expenses, you be used for, say, a uniform or a gas card?
So it would not be able to use typically for that unless it was like some sort of specialized, maybe like if you needed like special shoes because of your disability. The expense has to be related back to your disability in some way. So maybe a uniform wouldn't count as an impairment related work expense, but if you needed like some sort of specialized equipment because of your disability in order to do that job, that would be considered an impairment related work expense.
So would that include assistive technology?
Yeah, it could. Yeah, absolutely. If somebody needed that technology in order to do their job, and they needed that technology because of their disability, then it could be an improved ERWI. We always say if there's any gray area in if an ERWI will be approved or not, we always just say ask Social Security, and the worst thing they can say is no.
Okay. Okay. The next question is, how do expenses that your employer does not pay for, such as a uniform or office supplies, factor into your benefit and resources?
So I'm not sure what the question would be here. So I guess you would be if there are expenses that are unrelated to your disability, those are just expenses that you'd be paying for out of pocket typically. Like if an employer is not paying for the uniform, you would, and it's not really something related to your benefits. That would be something you would just have to pay for out of pocket.
Okay. The next question is, the video said that an employer can contribute to an ABLE account. How does that work?
So I see Ian put in here about the UGift link. So you can use that link to deposit into an ABLE account. So really anyone can deposit into an ABLE account on a person's behalf using that UGift link. So it's set up very similarly to like a college bound saver. It's a 529 plan. So really anyone can contribute to the account up to the annual limit.
Okay. And then I typed in a question about youth who work only during the summer accessing one of the Office of Rehab Services summer work experiences that were paid for. Do they qualify for the student earned income?
Yes, as long as they're making below that monthly limit and the yearly limit, they would be able to utilize it, that entire student earned income exclusion and keep their SSI. If they're making above that limit, then they'd be able to keep their SSI, and then they would start reducing it once they've exhausted the maximum amount.
Okay. Laura has her hand up. Laura?
Hi. So I asked a question about the ABLE account and the employer being able to contribute it. I'm wondering, like what are the regulations, because are they able to contribute that as like wages, or is that something separate? I don't know if that makes sense.
So I don't know that they'd be able to contribute it as wages. Like I think
So not
like
as wages, no. If
That's what I
they're
figured.
so your paycheck still has to go through, the W-2 process. So you're paying your taxes on that. Oftentimes, what's talked about with the contribution to the ABLE account is so someone who does not have SSI and Medicaid oftentimes can have like a 401k or an IRA, a savings account for retirement. With SSI, those count as assets, so those would very quickly put you above that limit. Many employers will match your contributions to a 401k or an IRA. Instead, they could put those matching funds they would give you there instead into an ABLE account. So that's how we've heard about it used before.
Okay, that makes sense to me.
Thank you, Laura. Does anybody else have any questions? We're coming up on the hour. No? Okay. Josh, I'm going to have you stop sharing and then I'm going to reshare.
sure.
Thanks. Okay. So this is just some of the contact information for Sherlock. We did place it at the beginning of our presentation, and it'll also go out with the follow-up video that was recorded today. Laura, do you want to quickly just go through the rest of the slides?
Yep. Sorry, I was trying to copy and paste all those links on the slides, but there's too much text, so we'll make sure that goes in an email. This is the self-directed support program at Ripen's current calendar. It's a little hard to read, but you can use the QR code to the right with your phone or go on our website, which is ripen.org/self-directed support.
Right. Jane's putting the link in the chat as well.
And that is where you will see the calendar and you can click on it to register. Our next event is going to be online, and it's a special type of event that will not be recorded. This is for participants who do self-direction, their families, their staff, and we'll have a special breakout room for those who speak Spanish. And this is an opportunity to give us feedback about what you want to see in order to foster connection amongst people who do self-direction, and also help us find tools that you find helpful to share with others. We have a newsletter called The Navigator that comes out monthly, and it's got our events, recordings of webinars, like it'll have this one eventually, and cool little resources from your community, all kinds of things that we really encourage you to sign up for, and it's really fun. So you can also do that on our website. And most importantly, we'd love to have your feedback about this webinar, and you can either scan the QR code. The link needs to be shared in the chat because you can't click on the slide, but and you'll also be emailed this later when we send everything out. And we just want to let you know that all of our webinars, such as this one, eventually go up on our website in a library, so you can look at them there if you missed something. And this is how you get in touch with us. The first numbers it goes to all of Ripen. Our email address in the second section goes to us. And you can follow us on some social if you'd like. And that's that.
Thank you. That's the end of our presentation today. Thank you, everybody, for joining us. Have a good night.
Thanks, everyone.
Bye.
Bye. Thank you.